All right, seeing none, this is an item that we will keep open. Thank you very much. The next presentation is WIC, Women, Infant, and Children Program. Welcome again.
Yes, again, this is Chris Nelson from Department of Public Health, and thank you for the opportunity to provide an update on the WIC program today. Committee staff have done an excellent job outlining the program and the agenda, but I'm happy to provide an additional briefing on the budget, including the revenue and costs. The bottom line for revenue is that we have sufficient funding from the USDA to continue to serve current and new participants. The November estimate included a future fiscal item and a new major assumption regarding the federal fiscal year 2014 appropriation, because it was not yet signed at that time. The appropriation has been signed, and our updated numbers for both the Food and the Nutrition Services Administration grant have gone up slightly, approximately $1 million each since the November estimate. The food grant is used to pay the 4,500 WIC authorized stores for reimbursement of foods provided to the program participants. And the Nutrition Services Administration grant is used for state operations as well as direct services provided by the local agencies in the 650 sites in California, serving 1.4 million participants. Direct services include nutrition education, breastfeeding support, referrals for other health services, and of course their WIC food voucher. We also receive funding from the infant formula manufacturer as well, approximately $248 million per year. The drivers of costs are primarily two factors: utilization and reimbursements to the stores. Utilization is measured in our program participation, and as you've noted, we've seen a slight decrease over the past year, which is consistent with national trends, and I'll address that more in just a moment. For reimbursements to stores, the rates to small stores were lowered at the end of 2012 at the direction of the USDA, and therefore in fiscal year 12-13, we spent much less than we had projected. And those unspent funds were very critical to California to continue services in October 2013 during the federal shutdown. There were other states that needed to close or reduce services, and California was fully open during that time. These lower reimbursement rates to stores are still in effect now and have resulted in a lower projection for state fiscal year 13-14 than in our previous estimate. And let's see, you also had a question about an update on the peer groups and MATER, so I'll jump right on into that. As you know, we've had a federally imposed moratorium in place for 2 years so that we could address increased food costs and program integrity concerns. We have made substantial progress to address the full spectrum, including implementing interim reimbursement rates to immediately reduce costs, adjusting what foods are authorized, how stores are authorized, our oversight efforts, and our last step is the vendor reimbursement system, which includes peer groups and reimbursement rates for each of those peer groups. California has worked closely with USDA last year to finalize the proposal and posted the regulations for public comment in December of 2013. We are now reviewing those comments and determining where it is appropriate to make adjustments to the regulations and seeking USDA approval for any changes. We expect to post the final action by April 1st of 2014. The effective date of those regulations will be approximately 2 months later to allow final IT programming changes to our system that calculates the actual dollar amounts that could be paid for each WIC check, and so that we can provide notification to the 4,500 vendors for their new peer group assignments and corresponding reimbursement rates. After these regulations go into effect, we expect the USDA to approve lifting the moratorium. We anticipate that USDA may want a phased-in approach, but we do not have any specific information about that yet. We are getting our staff and systems ready so that there are no operational delays once we receive USDA's decision. We are very motivated to complete this work and lift the moratorium, as is the USDA. It's a high priority not only for the WIC program, but also for the department and the administration, and we are fully committed to this effort.
I don't think you spoke about the decrease in the participation,
okay.
did you? Did I miss that?
No, I haven't yet.
Okay, good.
Okay, great. A primary factor driving the decline in WIC participation rates is the decline in the number of births and therefore the number of children. California has seen a decline in the number of births since 2007, particularly in Hispanics and whites, which are the largest group of WIC participants. The cumulative impact of the annual decline in births is sizable and has resulted in fewer children, which is by far the largest category of WIC participants. So over time, we've seen fewer babies, which then the next year there's still fewer babies, but now there's fewer one-year-olds. And then the following year, fewer babies, fewer one-year-olds, fewer two-year-olds. And now we've kind of had that saturation of the whole program. So when we expect to see the birth rate increasing again, it will take some time for overall numbers within the WIC program to continue to increase as well. The department is currently undertaking a detailed analysis of demographic changes in the size of populations eligible for WIC services by population characteristics as well as geographic regions. The analytic approach is closely following the methods used by the USDA to estimate eligible population size for the nation and individual states. The department is also undertaking analyses of data from the Maternal and Infant Health Assessment Survey, known as MIHA, to identify reasons pregnant women eligible for WIC services do not enroll in WIC during the prenatal period. This information will be used to target outreach and enrollment activities by local WIC agencies and other partners, and we'd be happy to share the results of that analysis with the committee.
Great.
I would like to point out a report published by USDA last year that outlines the WIC coverage rates for the nation as of 2010. WIC coverage rates compare the population served with the eligible population, and California has the highest rate in the nation at 80%. The national average is 63% of the eligible population is being served. And lastly, I'll address the WIC division chief position. Since the WIC program is so critical for California, it's critical that we find the right person for the position. We have just closed another round of recruitment as of last Friday, and the department is now reviewing applications and will complete the process as soon as possible. I would like to assure you that even though there has not been a permanent person in the position, there has not been a gap in leadership in the program. This program is a high priority for the department and the administration, and executive leadership have been very involved in ensuring that we are able to address all of the issues that are needed to successfully lead the program.
Thank you very much. Any comments by Department of Finance or LAO on these programs? Thank you very much. Senator Monning, do you have a comment? Any public comment? Please come forward. Good afternoon.
Madam Chair, members, Lori True. I'm the Executive Director of the California WIC Association, representing local agencies and the community at large. We're very pleased to hear the tremendous progress the department has made over the last year to address the vendor issues that were quite serious 2 years ago, and they're, in my view, ahead of schedule. It's a very complex problem that I think it took quite a long time once we started to open up and peel off the layers of the onions to fix. And I believe their proposal, which came out in December, really goes a long way to really address the issue. And we're looking forward to seeing it implemented in April, as stated, which really puts them on track to open up for business again after a very long gap, which is causing a lot of pressure from the grocery industry. But my community is really more interested in breastfeeding and nutrition and preventing obesity. And I just wanted to give you some more good news about the WIC program. You may have seen that the obesity rates for 0 to 5-year-olds have plummeted 43% in the last decade. And most of the analysis of that data points to the WIC program as the key driver, both in promoting and increasing rates of obesity, of breastfeeding. And in California, we're very proud of those efforts, and we'd like to see them continue. And the changes in the WIC food package, which not only have increased good nutrition in our population, but improve food access in every community because the foods are stocked in all WIC stores. So we'd like to get back to that work, and we look forward to continuing to work with the department to improve the health and nutrition of our participants. Thank you very much.
Thank you very much for sharing the good news. All right. That's an item we will hold open as well. Thank you very much for your presentation. Welcome. welcome to the presenters. We will now be covering the Nutrition Education Obesity Prevention Grants and the contract conversion. Good afternoon.
Good afternoon, Madam Chair, Senator Monning, subcommittee staff. I'm Drew Johnson. I'm the Acting Deputy Director for the Center for Chronic Disease Prevention and Health Promotion. The proposal you have before you today would establish 45 positions to continue the nutrition education and obesity prevention efforts throughout the state. These positions would execute much of the work that is currently being conducted by a contract which is set to expire at September 30th of this year. This contract conversion proposal is very similar in concept to proposals that this subcommittee has entertained over the past few years. The overarching justification for the proposal is to be compliant with the law. Article 7 of the state constitution includes an implied mandate that any work that can adequately and competently be conducted by state civil service staff should be. This conversion would actually save about $12 million ongoing. We are planning to allocate the vast majority of the savings to local health jurisdictions. In the NEOP program, the Nutrition Education Obesity Prevention Program, the local health jurisdiction response is the backbone of public health from our program's perspective. And so it's appropriate that they receive this additional funding to do some of the more good work that they've conducted in the past. That being said, I do want to acknowledge, though, that we recognize the very important value that community-based organizations provide. They are partners with local health jurisdictions. They're partners with the Department of Public Health. And we want to continue those efforts. And one of the efforts that we're doing currently is we've just let 7 contracts with regional contracts with 7 community-based organizations to provide technical assistance capacity building for our local health jurisdictions so that kind of all boats float to the same level. And we're very pleased that our current contractor, PHI, received 2 of those awards so that they will remain close with us and continue to do the good work that they've done with us currently and in the past. I think most importantly, I'd like to point out that from all of the allocations that we provide with the local health jurisdictions, we've made a requirement in the funding allocation model that up to $30 million will be required to be let to community-based organizations. So while we rely very heavily on the local health jurisdiction response, we also value that partnership that they have. They understand the local condition. They understand the value and the broad perspective of community-based organizations. And so we're requiring them to actually work with up to $30 million to that level in response to physical activity and nutrition education. The positions that we're proposing, the 45, are not exceptional in any way from a technical expertise perspective. They're health educators, which is a very ubiquitous class across the department. There's associate governmental program analyst, which is a journey-level analyst position that is pervasive across state government. There's public health nutritionists and the like. So these are the kind of duties and activities that we've analyzed that we need to have going forward, are classifications that are ones that we think we could succeed with, that we can fulfill with an ambitious recruitment and hiring process. Within the subcommittee's write-up, there was some questions about the $12 million savings that we're estimating, and that is situated in 4 or 5 kind of big buckets. The first one is there's going to be fewer staff. The current contract right now includes about 70 staff with our contractor. We're going to actually have 58 staff, the 45 which is being proposed here in the BCP, plus an additional 13 which are going to be included in a CSU-UC interagency agreement. So we'll go from 70 to 58, which will realize some savings in that regard. There's also some savings that are included in the administration of a contract, any contract, and this one is no exception to that. So there's almost about $1.9 million for them to administer their own HR, their contract management, their accounting, their personnel, those kind of things. That's going to be savings that we'll realize from bringing these positions in-house and what we can then push out to the local health jurisdictions. In addition, there's a larger chunk of money that our current contractor uses to subcontract with community-based organizations to do some of the work that either will expire at the end of the contract or we will continue at the local level as the requirement that I just spoke of earlier of up to $30 million of subcontracting with community-based organizations. But that $6 million that's currently in the contract is something that we're going to push the vast majority, again, out to the local health jurisdictions. And the final piece is an indirect cost that all contracts include as well, and this is kind of to support the infrastructure of the organization that we contract with, and that's about $2 million that we no longer will have to pay for through the contract process, but we'll also be able to look at that as a local health jurisdiction allocation increase. The last thing that was brought up in the subcommittee write-up was in response to a letter that was received by the Department of Social Services from USDA. USDA actually is the one who contracts with the Department of Social Services, and then we have an interagency agreement with them to conduct the SNAP work. CDSS has 4 or 5 different partners to do SNAP, and we're just one of them, including UC Davis and Department of Aging and others. And in the letter, they were inquiring about the timing of this, that they thought that they would have had a little bit more lead time. And we're going to respond in writing, and we've been talking with USDA as well as CDSS to ensure that we're on sound footing going forward. But we couldn't actually talk any sooner than we really did because of the confidential nature of the budget building process. We couldn't bring them on board until after the budget had been released by the governor in early January. Each year, we're required to submit a state plan to CDSS, which is then transmitted to USDA, and that plan is due to USDA August 15th, and so we will have a full-blown proposal for next federal fiscal year, which starts October 1st, which will include this transition, which will include the 45 positions, the work, what the analysis that we conducted to ensure that we can keep this at a high level and continue the great work that's been done with fewer staff, but with more effort with the local health jurisdictions. The letter asks for some preliminary information before them, which we're working on currently, and so we intend to have that funneled through CDSS and over to USDA in the next couple, 3 weeks. But that's kind of the process that we've engaged with USDA and CDSS going forward.
And then I think there were some issues raised by USDA regarding converting the staff to state staff. Yeah.
So we did do an analysis of the activities that are currently being conducted through the contract and that which we think we could execute the same by going forward. And we came up with the 45 staff that you see in this proposal and the 13 in the UC or CSU interagency agreement, which we're working on executing currently. So it's fewer staff. We do believe that because of the model that we're working in and the deliverables that are set forth in the current plan and in the plan that we're going to be working on this summer for next fiscal year, that this is sufficient to actually maintain the level of success that USDA is accustomed to.
Okay, thank you. I want to ask you to answer this now, but you did speak extensively about working with your community partners and how important that was. Maybe we're going to be keeping this item open likely, to confer with my member here, but the issue about making sure that you reach hard-to-reach populations, I'd like to hear more about as we continue the discussion on this. Senator Marty?
Yes, thank you. So I think we're all encouraged by the information that Ms. True shared about the dramatic decline in obesity in 2 to 5-year-olds whose consumption decisions are being made by parents, presumably, not by those kids. What are the trends for adolescents and adults right now in California?
Yeah, so the trends are bending in the right way. And to actually answer to kind of back into the side of the question is, you had a question earlier about what kind of media do we have, PSAs. We do have an extensive array of media related to radio, TV, print, billboard, targeting our population, our SNAP population, which is 185% of federal poverty level. So we do feel that there's some inertia that is actually taking place that you saw in the the recent report by CDC, and we hope to continue that, and also with the adult population as well as the adolescent. Our current contract is about $12 million with Runyon, Salzman, and Einhorn, who does our media purchasing and part of our creative. PSAs, as Ms. Forrester indicated, is not something that is as active as they have. I remember working years ago in the Office of AIDS doing it, and I used to love waking up at 2:30 in the morning to see that ad run, you know,
right.
that they were required to do.
Well, that's the problem, the lack of comprehensive coverage with PSAs. So on the SNAP eligible population, I know there have been some programs in different communities where if people use the swipe card at a farmer's market, they can get an enhanced buying power. What's the source of that supplement? Are you familiar with those programs?
I'm not. I believe that's more in the CDSS part of the bailiwick. We're trying to recruit people to get into SNAP and also to work with nutrition education and obesity prevention. But if it is a part of it that I'm just not aware of in my acting thing, then I'll get back to you.
Yeah, I'm just curious. I've heard about it. It sounds like a great. Somebody swipes for $10 and they get $15 of buying power. And I'm just unclear what that source of that supplement is. So if that's something you could find out for us, even if it's not directly in your bailiwick, it would help me be more conversant in our community.
The WIC program also allows you to get more fruits and vegetables for your dollar and go to farmers markets during the summer as well.
Great. Thank you.
Will you be working in conjunction with any of the new efforts with regard to food deserts as well? I'm imagining you probably will be working.
We definitely target areas of the state, and the locals do. And when I kind of spoke of like understanding the local condition, they know where their 185% of federal poverty level lives, works, and breathes. And so that is where targeted areas the funding is accentuated. So yes, that's absolutely.
Thank you very much. Thank you for the presentation. Any comments by LAO?
We recently received a copy of the letter from the USDA that the department discussed, and after reviewing that letter, we recommend that the department be asked to report back on its ongoing conversations with the USDA at future budget hearings, including whether the USDA approves of the proposed contract conversion and whether the USDA is satisfied that the department will be able to fund the proposed level of state staff going forward after the projected funding reductions.
Thank you. Department of Finance? All right. Would you like to respond to that?
We would be happy to. And most generally, USDA has been taken more interest in kind of the interventions and approach and model, and not so much the implementation. They have in this case, and we think by working with them closely and providing some additional information that we were unable to provide prior to the letter, that we think we can get to a place of satisfaction. But we would be happy to move that forward.
And we have confirmed that with USDA, that we're going to have ongoing discussions through this entire process about the implementation and execution of this conversion.
Very good. Thank you.
We have a good relationship with them, and I think we can continue down that pathway.
That's good news. Thank you very much. Yes, Senator Ronnie.
I don't expect you have this at your fingertips, but related to the advertising outreach, I'd be curious to see any data that shows your budget related to that versus any analysis of the targeted advertising of unhealthful products in our communities.
I'm sure it's skewed, and we will get that for you.
Thank you.
Public comment, please.
Good afternoon. My name is Chris Boyden, and I'm representing Alameda County Office of Education and a program called Project EAT that was formerly a local incentive awardee with the California State Department of Health. I'm here representing 40,000 of the most underrepresented young folks and their parents in Alameda County. For the past decade, we co-created the largest network for a healthy California to decrease childhood obesity through a variety of effective and fun interventions with youth and their families in classrooms, in school gardens, in community gardens, and across the community. Just what the First Lady asked for. The program was highly successful. We saw an increase in the consumption of fruits and vegetables, physical activity, and we also saw an increase in hope. We saw that young folks were actually feeling that they could make those daily healthy choices. The program was reviewed by USDA and lauded as a model program that should be replicated throughout the state of California. And for our success, we were rewarded with a 94% reduction in funding. Alameda County itself lost $8.4 million. We lost all of our funding, and we received a 6% funding from the local health department. We anticipate, with the subsequent loss of funding to Alameda County, that we will be completely defunded by the end of, by September 30th. Throughout this shift, even though CDPH received no cost in funding, and still say that it was just a movement towards the local health department, we have a very devastating situation in which we found, an evidence base in which we worked really hard. PHI stepped in to help us capitalize and leverage the loss of this funding and the last decade of this work to assist us in keeping our trusted relationships with the most underserved, with the most culturally diverse folks in Alameda County. This proposed BCP will effectively eliminate the last vestiges of the Network for a Healthy California. It will eliminate the on-the-ground efforts of folks who worked for more than a decade in California. And it's difficult to understand why. Okay. Thank you very much. Appreciate your work. I have a few pamphlets about what we used to do.
Thank you. Thank you for your work.
Thank you very much.
The source of the funding.
It's still the same. It's still there.
And it was federal funding?
Yes, ma'am.
Yes.
Yes, ma'am. It's USDA Western Region Office. It's the same funding.
Yes.
SNAP Ed, Nutrition Education.
Yes. And I am familiar with the program, of course. Will you talk with my staff after the hearing so we can get some more information from you so we can help you figure out what happened?
Thank you.
All right. Thank you very much.